and welcome to Heart Attacks Demystified, a podcast series dedicated to empowering you with the knowledge about heart health. I'm your host, Anisha Nayar Dhawan. When you hear the words heart attack, do you think that can't happen to me? Maybe you assume it's only for someone older or your neighborhood uncle who loves his fried snacks. But here's the reality. Heart disease is India's leading cause of death, responsible for nearly 31% of all fatalities according to WHO and ICMR data. And no, it doesn't only affect those with a family history or unhealthy habits. In fact, some studies show that over 50% of heart attack victims in India are under the age of 50, and many lead what they believe are normal lifestyles. The truth is, heart attacks rarely strike without warning. There are signs, risk factors, and preventive measures that can make all the difference. This series will bring you the insights from some of the most respected healthcare professionals. Together, we'll explore why cardiac conditions are rising in India, decode the hidden risk factors, and spotlight cutting-edge medical technologies transforming cardiac care. Heart Attacks Demystified is brought to you by Abbott, the global healthcare leader, in collaboration with the Times of India. So let's start the first episode of our series where we discuss the making of a heart attack, causes, triggers, and prevention. I am delighted to welcome Dr. Subhash Chandra, Chairman, Cardiology and Structural Heart Disease, BLK Max Super Speciality Hospital, Delhi, and Dr. Viveka Kumar, Chairman of Cardiology, Chief of Cath Pan Mats Healthcare. Thank you both for joining us. Such a pleasure to have you on our show. Dr. Subhash, I'm going to start with you first. Now, is heart attack really that sudden? Or are there any telltale signs? Does it build up over time, and what's really happening?
Okay, so that's a very relevant question. So heart attack definitely is a sudden event. But the process which leads to build-up of heart attack is a slow process. It is brewing up for years together, and it is as a result of a bad and unhealthy lifestyle, which unfortunately in the modern world is very, very common, where the youngsters growing up, kids, are not pushed into the outdoor activities or playful activities. Most of the time they are sitting at home, they are inert. And that is what leads to obesity, and on top of it, the unhealthy food habits, which is a kind of social disadvantage. If in your household the food cooked is not healthy, then obviously a child is forced to eat that unhealthy food, or sometimes even they order from different apps and from market. And that is what leads to buildup of plaque in coronary arteries. And one sudden day they break or rupture, that leads to thrombosis and total occlusion of the artery. And that is what is responsible for sudden heart attacks.
Explain to us what is occlusion and thrombosis in simple words.
So the coronary occlusion means the artery gets blocked completely. The blood is not flowing forward. And thrombosis is a process of cascade of blockage in which once the trigger of blockage happens, it constantly perpetuates and until it completely blocks the artery.
Okay.
And there's a total cutoff of blood supply to the heart.
Correct.
And that is what leads to heart
attack. Dr. Viveka Kumar, so we've understood the process, but could you tell us what is the difference between a heart attack and cardiac arrest? Is it the same? Because most of us believe it's the same.
Yeah, so it is very important to know that the heart attack is not same as a cardiac arrest. In fact, when we say heart attack, there is a sudden stoppage of blood supply to the heart arteries affecting one or other part of the heart muscles, and it's an acute emergency. And similarly, the cardiac arrest is an arrhythmic problem where the heart starts beating chaotically. It beats so fast that it is not enough time to generate blood pressure, and it is even more serious emergency than a heart attack. So heart attack could trigger a cardiac arrest, but many people would have cardiac arrest without a heart attack. So we call it cardiac arrhythmia. They would have by birth different channel defect. We call it channelopathy, or anyone whose heart is weak for various reasons. Suppose during COVID or other infection, heart has gone weak. And then without having a superadded heart attack, they can have a cardiac arrest. So cardiac arrest is an chaotic rhythm of the heart where heart beats so fast that it is not compatible with life for more than 30 seconds. So it's a much more serious emergency. Whereas heart attack is when the sudden cessation of blood flow, because the clot formation or furring of the arteries in the major arteries of the heart would lead to that. Having said that, heart attack could be a most common cause of cardiac arrest. Almost 60 to 70% of the cardiac arrest would happen when the patient has got ongoing heart attack.
Right. Dr. Viveka Kumar, when it comes to heart attacks, people believe the main culprits are cholesterol and blocked arteries. Is this 100% true, or are there more players who ruin the party?
Yeah, so that's the most important part of the heart attack that we have not yet understood, and that is why you will not be able to predict it in advance. So heart attack is something which is, a sudden event where the triggers and the, risk factors are building up over the period of time. So cholesterol is one of the reasons, but we say that the risk factors are multiple, like sudden exposure to stress, either undue physical stress, emotional stress, smoking, or exposure to pollution. So even pollution, exposure to the financial loss or some bereavement in the family, that can also trigger a lot of, hormone release in the body, like, interleukin and all those things. And they can cause rupture of the plaque and can cause heart attack. So the cholesterol is a very important predictable factor, but the people who have had high blood pressure, high sugar, so these are the people who will have more often heart attack and more serious cardiac issues than those who do not have. So we say that it is a multifactorial main building things, and these risk factors would multiply. And like if somebody has got diabetes, has got high blood pressure, is a smoker, so this keeps on building, and they're
sitting on a tank bomb.
Yeah.
And they're waiting for the trigger to be put.
So the trigger could be either undue emotional stress or physical stress, or even a puff of cigarette can trigger the acute heart attack.
That's quite a serious side effect of smoking.
Yeah.
Dr. Chandra, want to understand from you, but people say, oh, this is a genetic issue. If it runs in families, is it really all genetic, or is it also related to the kind of lifestyle you have? And if it runs in my family, if my mom or dad had it, does it mean my fate is sealed?
Okay. So to continue with what Dr. Viveka has said, the traditional risk factors would be diabetes, hypertension, smoking, and high cholesterol. So once you're done with that, there are a lot of modifiers on top of these risk factors. And smoking, mind you, is a very, very important risk factor for the young heart attacks in our country. So genetics definitely plays a role. So one should look at the history. If a man has had heart attack before 55 years of age, and a woman had a 65 years of age in their family, then you are susceptible to have a premature heart attack. So that is the role of genetic, and these people who have such history have to be extra cautious in not piling up those traditional risk factors. On the contrary, they should strive hard to neutralize them by virtue of having excessive regular exercise and eating judiciously and controlling their LDL cholesterol, which is the main culprit in causing these heart attacks. So that is the role of genetics. It's a modifier to the traditional risk factors.
Right. But you said if there is an incidence of heart attack, what about incidences where, oh, we got angioplasty and there was some sort of blockage, so we got a stent put? Does that mean that the risk is high?
It is in the same category.
You don't have to wait for that big trigger to happen, but even if blockage is there in your family, you could be susceptible to it.
It just notifies that you have had coronary artery disease. You had a block, you had an angioplasty.
No, not the person. Their parents. If their parents, they'll have a heart attack, but just had a blockage.
You qualify.
You will qualify with high genetics.
Yes.
So I think that way, Dr. Viveka Kumar, a lot of people would be, in the high risk category.
Yes. So, yeah, that's true. So, mainly it is people who have had any coronary intervention. In fact, there are many people whose parents have got, on CT, coronary angiogram or conventional angiogram. It has been found that there is a, moderate degree of blockage. So, they also are at a higher risk of having these children would have higher risk of having coronary artery disease. Whether it manifest in the heart attack or not would depend on the modifiable risk factor. So suppose on top of that, if the person smokes or has got, infections, so you'll be surprised to know that the triggers are not only these traditional factors, but even if somebody has got influenza, that increases the risk by 40% because all these things would make blood more coagulable and the clot can sit in the heart and artery and can cause acute heart attack.
This sounds very serious, because people don't connect the two and, then assess their risk. But Dr. Viveka Kumar, you spoke about stress. Now I want to take your opinion, both of yours opinion. How crucial is stress as a trigger for heart attack?
Yeah, so I think we know that the stress can cause rise in risk factors over a period of time. Like it can lead to high blood pressure, it can lead to high sugar, it can lead to, various other manifestations, but acutely. So we have seen that if you look at the 20 stress things like either financial loss, bereavement in the family, or stress of not doing well in job, quitting the job. So all those things, the number one cause which triggered maximum number of heart attack was huge financial losses. And the second of that was the very close, near and dear, especially the spouse has bad outcome in family bereavement, then it can happen. So these are the two top most stress factors. But it has been seen that the heart attack and the cardiac event can happen even because of the other risk factors, stresses like not doing well. So it all boils down to the fact that any stress which brings the trigger hormones in your body to a very extremely high level can trigger an heart attack.
Okay, but Dr. Chandra, what Dr. Viveka Kumar is saying is really surprising to me. I thought, oh, I'm stressed, suddenly something happened. I never anticipated this. Kabhi bhi hoga, and suddenly my heart races and then it could lead to a heart attack. But he's saying कि अगर रोज के रोज आपको ऐसे स्ट्रेस होते जा रही है तो ये भी एक लाइफस्टाइल रिस्क फैक्टर ही बन गया है कि आपकी फिर बॉडी predisposed हो रही है for all the bad news in the world. Is this true? I thought it's the one sudden thing that will lead to a heart attack.
I'll give you a very important scientific clue that majority of heart attacks or brain attacks would happen early in the morning between 4 o'clock and 7 o'clock.
तब तो हम सो रहे थे, तब क्या stress
And
होता है?
the science says that that time of your body has maximum catecholamines being secreted. So once somebody suffers from a chronic stress or acute stress, he is subconsciously secreting excessive catecholamines.
What are these?
These are the fear hormones. It is something like if you see a dog suddenly coming in front of you, a lion coming in front of you, and you are suddenly
Please explain this to me. Even if I was fearful in the day, I went to sleep. Why should it start secreting at 3 or 4 o'clock in the morning?
because that thought is constantly
You're saying my brain is processing all that when I'm sleeping.
So that's leading to constant excessive secretion of catecholamines. So any kind of stress in the long run would lead to amplifying these risk factors and lead to sudden heart attacks. It has been seen commonly that people suffering with huge financial losses will have an acute problem. There is something known as broken heart syndrome. I'm citing it from the
Those who are heartbroken.
Yes. So somebody breakups can lead to breakup or bereavement or loss of your parent or your spouse can all lead to a sudden heart attack. That's a broken heart syndrome. It is also common in our scientific parlance where a person who has had a big surgery and to our surprise the next day we see that his heart has suddenly gone weak. And in our language we call it a special cardiomyopathy. It's called Takotsubo cardiomyopathy. This is called a stress cardiomyopathy. So there's ample proof in science to prove that if you are under stress, so the focus has to be, in controlling your lifestyle in a manner that you are free from stress. So you can devise mechanisms to, and I know it's tough. It is tough, but one can overcome it by practice.
Yes, I mean, you have to be mindful about it. Exactly. You can't help the stress, it will come, but how you go back to your normal homeostasis and status quo. So, Dr. Chandra, are there telltale signs that there is build-up of trouble? Is there something that I can look out for that will tell me better get back to line, better get back on line? What are the telltale signs?
Yeah, so first let me tell you the common signs and symptoms of heart attack. When should one reach a hospital or see a doctor? And that would be classical chest pain in the center of chest.
Center of the chest.
In the center of it, not the left. That's a misconception that your heart lies on left. So any pain coming on left is a heart attack.
Oh.
the signs say that it is in the center of the chest. It could go to your jaw and your throat. It could radiate to your left arm. It is accompanied with sweating, sense of uneasiness, sense of doom, excessive vomiting, nausea, or blackouts.
Breathlessness.
All of them.
Breathlessness also.
Breathlessness is an important part of these symptoms. Once this compendium comes in totality, that is when you suspect that you are having something abnormal. A recurrent gaseous problem can be a trigger or an indication of an ongoing heart
That's
attack.
acidity.
So that is very common, and Dr. Viveka would agree. A lot of patients would miss the bus and they have already had a heart attack, presuming that this is all gas. By the time they land up in hospital, to their horror, they realize that they actually suffered a heart attack. So excessive gases should also not be ignored.
Right. Dr. Viveka Kumar, are the symptoms of a heart attack different between what it shows in a man and a woman?
Yeah, so I think we always say that the heart attack, the classical symptoms where, as Dr. Subhash said, that or commonly people know that there'll be severe crushing chest pain and the radiation into the left arm, and it will be there constant for, half an hour to 1 hour, depending on when the patient has
You get
gone
that much
treatment.
time. You
No,
will
so
be
it
in this
continues.
pain
Yeah,
for
so
an
that
hour
pain,
or so.
yeah, that can continue for 6 to 8 hours till that part of the heart is still not completely gone or dead. So that is the classical thing. But there are a lot of people who have the jaw pain. A lot of people would have back pain. So in fact, recently I had a dentist mother, and she took her mother to her dental clinic that probably this is dental pain, but that was a ongoing heart attack, and that
Her mother's
dentist had a
heart attack.
heart attack. Yeah. And then as you asked me, that the symptoms of heart attack are different in males and females. So almost the female would have atypical presentation. They will have feeling of, sudden weakness. They will have feeling of uneasiness, more sweating and letharginess. So they will feel that it is coming because of the, weakness, or they had missed their lunch or something like that.
Sleep properly.
So they didn't sleep properly, or they would have more gastric symptoms. So the people would have, feeling of irritations, their nausea, vomiting, and they will again. So these are the symptoms where the patients would, instead of going to a cardiac center, they might go to a gastro center or general practitioner that gives some. People will take something which is antacid kind of thing, and they feel that probably, and then placebo effect is always there. Whatever medicine you take, you will feel that they are feeling okay for some time. But if it is happening to such an extreme that it is for the first time you are seeing those kind of gastric symptoms, you never had this intense gastric symptoms in the past, or the type of jaw pain associated with feeling of impending doom or feeling of gross weakness and all, which you never had in past. So if it is happening for the first time, you need to get the heart attack ruled out.
All right. Some people, I think I've heard it, if you're unable to lift your right arm, means that it is probably heart attack. Is there any one sign that if you do this, it's a heart attack?
No, so that is, I said that it is the heart attack can be of various severities. So it can be happening because of a small artery blockage. So it not be very intense. So in fact, quite a few heart attack can be missed. Almost 6 to 8% of the heart attack can be missed over, because the problem will be there for half an hour to 1 hour, and by the time they thought of going to the hospital, they will feel okay. But the bigger heart attacks would be always there. So, and the best thing to, even sometimes the early ECG patients have come to the hospital, they got the ECG done, and that did not show major changes, and then by the time they reached home, they had a cardiac arrest at home. So you need to have a serial ECG, the early biomarker, and the imaging of the heart, that is echocardiogram. So these are the things where, so you have to have a very, very high index of suspicion. Otherwise, many of the heart attacks could be missed and can be lethal.
I spoke about missed heart attacks. It is something called, I've heard, silent heart attack. What is a silent heart attack? Is it really a real thing?
So, yeah, it is something when you're not very vigilant and the very subtle symptoms you're missing, as Dr. Viveka said. But silent heart attacks or silent ischemia would mean lack of blood supply. Lack of blood supply to the heart, which leads to angina. Angina is a precursor of heart attack.
Okay.
So that could be missed in a patient who is diabetic because of some neurological, neuropathic issues. It would be missed in women commonly, because in women, heart attack has sometimes very subtle signs and symptoms. A vague weakness could be an indicator of heart problem, but they just missed it. Or even in patients who are very elderly. So these are 3 or 4 subgroups where silent ischemia is common, and that could only be digged out if you order a special test, as in a Holter recording or any other ambulatory test, and that can dig out a silent ischemia or silent heart conversion. So in patients who are diabetic, women, very elderly, you got to be very, very careful in evaluating them, getting their ECG, getting their echocardiography. On echo, you would realize that the ejection fraction or heart function has suddenly dipped, whereas the normal ejection fraction is 55 to 60%. To your surprise, you find somebody had a 35% ejection fraction. And that happened because this guy suffered a silent heart attack in past, in a week or a month ago. And that is how they ended up. So this is one of the manifestations of a previous heart attack.
So at what age should one start testing? This is something so insidious. It's coming and you're not knowing what will come without a warning. So how can I, try to protect myself? When should I start testing?
That's right. So that's a very important question. We have been time and again telling that there are conventional risk factors are dyslipidemia, which is high LDL cholesterol, blood pressure, and diabetes, of course. And unfortunately, these are all silent problems. So, and it is also said if somebody has a high LDL cholesterol, it is not that the intensity of high cholesterol, but the number of years he is exposed to high LDL would determine whether he is suffering from premature heart attack or he'll suffer at the age of 60 or 70. So in my opinion, a boy who is a girl entering school at 16 or 17 years of age, that should be ideally the first time that their blood pressure should be checked, their lipid profile should be measured. And if they're found to have one abnormality, it should be controlled from that age. However, conventionally, we suggest that anybody who is past the age of 40 years, man, women both, they should submit for some kind of health check so that they can dig out these silent or insidious problems lying in their body.
Okay.
And that checkup should include blood pressure measurements, cholesterol measurements, HbA1c, which is measurement of 3 months sugar, and various other risk factors in their body. And from then on, you should start. We always emphasize as the cardiologist that one should remain active in life. If somebody is going 10 rounds in a park every day, and on 6th round he feels fatigued or breathless, that's the first sign that there's something abnormal in his body. So we always say that be active. Try to go upstairs. Don't use lift.
And the day you start struggling in your activity is when you should be worried.
We should submit,
and start investigating.
Exactly. And that's what we also practice.
Okay.
We are in such a profession where we have to keep people healthy. So if we are not healthy, how would we ensure that others are healthy? So we keep a regular check on our own health. That we have been running, jogging,
Really?
doing every
That's
activity.
really nice because I thought
And keeping a close watch and
doctors have no time. They are seeing not so many patients.
Not at all.
Okay, it's very heartening to know that you are mindful about your health and taking all precautions possible. Dr. Viveka Kumar, Dr. Chandra has told us about when you should start for testing or retesting, etc. But if there is one significant change that I can make in my lifestyle to protect myself, what could it be?
Yeah, so I think the strongest of the lot, it would be to have a, physical activity. We call it sedentary lifestyle is smoking equivalent. So that has been given new that it is as bad as. So if you want to have one thing which will protect your heart, you have to have, regular exercise, and that too, not just the weightlifting. And also we say that aerobic exercise, not the isometric, where weightlifting, weight training is not the good exercise for the heart. So you need to at least clock more than 12 to 14,000 steps in a day, or run or jog for at least an hour. So any aerobic exercise, running, jogging, swimming, cycling, all of them are good. So one can walking also.
Walking also.
Yeah, walking also. That also good. Yes.
Okay. Dr. Chandra, Dr. Viveka Kumar is saying movement is important. Movement is a very important predictor of your heart health. And you said cholesterol. If there's higher cholesterol, it looks like diet is also important. So what is more important? Exercise or diet, one versus the other? Which is the most important?
So I'll give a cue from a farmer who is living in village. He eats everything. He eats deshi ghee, he eats jaggery, he eats his food. but he works out in his field. And he's healthy until 78
Healthy,
years
you mean
of
he
age.
doesn't have that high LDL
Exactly.
and clogged arteries?
Maybe. So the energy intake and burning it by exercise
Okay.
is what
Equation.
matters.
In
The
versus out.
equation, that's
Okay.
exactly in versus out. That is what determines your weight. That's what determines the deposition of cholesterol in your coronary arteries. And of course, on top of which, the other modifiers like stress. So that cue should be taken in our day-to-day life.
Okay.
So when Dr. Viveka said that sitting is the
The new
modern day
smoking.
smoking, taking sweets is the modern day opium. So both, that's about habits.
So, Dr. Chandra, can you elaborate a little more? Because some people think, oh, I'm making a healthy choice. Could there be some delusion there? Could they be like wrong when they think they're making a healthy choice, but it's actually not good for their hearts?
Milk is very popular in our
Yes.
in our society.
Milk, paneer.
And from childhood, we are told that.
Yeah.
So milk definitely has good proteins. It should be given to growing up kids. But a milk which has a very high cholesterol content, like भैंस का दूध. Some people say गाय के दूध में कम होते cholesterol, क्या हम
पेट ही नहीं भरता उससे तो.
पेट नहीं भरता. So this is a myth. Milk which is fat free or skimmed is best for you. You could have fermented milk in the form of curd or sometimes paneer. That is still okay. Dry fruits is a must in your diet. It could have akhrot, badam, pistachio. All of them are good. Lots of greens and vegetables, pulses, egg white. If you're fond of non-vegetarian food, try to avoid red meat like mutton. You could resort to a lean meat like chicken or fish. Fish is really good. It has omega-3 fatty acids. So good for heart. And if you're vegetarian, that's the best diet.
All right. Dr. Viveka Kumar, in times of a heart attack, say you come to that critical point and you see somebody suffering from a heart attack. Now, you want them to survive and you are taking them to the hospital. In the interim, are there any medications, processes that you can do to ensure that, the heart doesn't stop or, the artery is clogged, but blood still goes? Anything that you can do?
Yeah, so I think the most important thing which I would tell is that if you are suspecting that the person is having ongoing heart attack, first thing is that he or she should not drive to the hospital
Themselves.
Okay. So they should not. They should be driven either by ambulance or somebody should take them. Second thing is that the moment you suspect, you need to, because all the heart attacks are pro-coagulative process. It means the clot is getting filled in the heart artery. So you need to take something which decreases the clot formation. Even if they reach the hospital, we confirm that the heart attack is there. We load them with the blood thinner. So the best treatment for these patients that they should be reaching to a cardiac hospital where the Cath lab facility is there, because we immediately do primary angioplasty, restore the blood supply by putting a stent or ballooning it, removing the clot. But it is not available in best of the countries everywhere. We have got access to other facilities, like we give injectable blood clot busting injections, which is called thrombolytic therapy, and we call it facilitated PCI, where you have given the thrombolytic therapy, clot busting injection. Almost 70% of them would restore the blood flow, and those who are not, they can be taken for facilitated PCI, where after the blood thinner and all, we can again check by angiography, and if the blockage is still there, we can put stent and restore the normal blood supply. So the whole process of heart attack is because of the excessive clot formation in the heart arteries. So to treat it, you need to give blood thinners. So the blood thinner is the most important thing to be given immediately.
All right. Dr. Chandra, Dr. Viveka Kumar has told us about, the antithrombosis injectables as well. Now, both of you have been working for such a long time. So could you also elaborate on the new treatments available for heart attack? And have they had a perceptible improvement in improving survival chances?
Yeah. So the process of angioplasty, as Dr. Viveka alluded to, is to, if your artery is totally blocked, the first task is to just push in a wire, take a balloon, open and get the flow. And that goes a long way in saving life of these patients. And the science has enough proof that is the primary angioplasty. We call this process a primary angioplasty, which is happening in emergency, is the process of saving lives, truly saving. The mortality benefits only accrue with primary angioplasty. So that's the modern treatment.
But this involves, putting a catheter, or it is a invasive
process which we normally do from the wrist or groin. It takes a very swift process in our hands, and once we have resumed the flow, then we ensure that in the long run the artery doesn't get blocked again. So there we put special stents. These are the metallic tubes made out of alloy, and on top of alloy there are polymers and drug. The drug would release for next 15 days or a month, and this will ensure that the process of healing would not result into reocclusion or re-snowing of the artery. Therefore, drug-eluting stents have revolutionized the overall care of the heart attack patients. We have in our records patients who underwent angioplasty 20, 30 years ago, and the arteries are pristine.
Because of the drug?
Because of the drug-eluting stents. Okay. So that's the biggest revolution. What remains behind is a very fine alloy thing as in a scaffold, and the artery is patent forever. But that does not guarantee that this guy will not have heart attacks because of the blockage in the other arteries. If he keeps leading unhealthy lifestyle, it's like taking your car from garage as pristine, but you keep going in the mud, and it keeps coming back to the garage. So likewise, your body will need to keep going back to the garage if you are not careful about lifestyle. So once the heart attack treatment has happened, it is mandatory that this person should be very, very strict on their lifestyle changes. Okay. It could be eating, regular exercise, less stress, controlling diabetes, not smoking, not chewing tobacco, and that's it.
All right. Dr. Chandra, I'm going to ask both of you this question, please. If there is one golden rule that you could give to our listeners and our viewers to protect your heart, what would it be?
The healthy lifestyle. And it should be inculcated right from the childhood. So the onus lies on parents that when they're raising their kids, you have little kids, so this is high time you should also take a cue. They should be given healthy food. They should be discouraged from, there could be a steal day, maybe twice or thrice in a month. You can eat samosa, kachori or whatever. But you should know that you got to burn it. Like I love my sweets and I do take it sometimes. But I only take it once I take a vow that I'm going to burn it the next day by running or jogging or doing whatever. It should not become a habit. So eating is the most important. And I think we elaborated in our discussion quite a lot that what should be eaten, what should be avoided.
Yes.
The second is there should be a habit of doing some kind of exercise. And Dr. Viveka said that the dynamic or aerobic exercise is a must. But there should be a combination of three where the muscle strength is important, especially people growing up like us. The muscles start getting weak at the age. So strengthening muscle by moderate weight lifting or stretching. The flexibility of body by way of yoga. So yoga is very important, which is a combination of respiratory exercise and stretching of your body, flexibility for body. So a combination of three should be incorporated into your regime of doing exercise. Okay. And of course, there should be some mechanism to bust the stress. You should try and stay away from taking any stress in life. So you should be on a philosophical note. You must realize the worth, value of your life. You should stay away from unhealthy competition. You should learn good things from your peers. You should ignore, getting angry or, throwing your temper at silly things. That is bad for yourself. So stop getting angry.
And especially for those on the roads.
That's it, exactly.
खून जलाने का कोई फायदा नहीं है.
And unfortunately, of course, Dr. Viveka will also add on to this, the pollution is adding up to the problem. It is an underestimated, underrated risk factor.
If we don't take care.
We don't take it.
Dr. Viveka Kumar, what is your golden rule for a healthy heart? Because sir has given me at least 4. You would talk about at least that one thing that you think is the most important.
Yeah, so I would always say that the slogan, the more you walk away from the heart attack. So number of steps it translates into your cardiac protection. You need to have 6 S in your life to be removed. First is the smoking. So no smoking, whether it is passive or active. So we call it second-hand smoking should not be there. Sleep should be adequate. Stress should not be there. Sweets should not be excess. Sugar should not be, salt should not be excess. And then you have to have a peaceful mind. So these are the things we call it acronym as 6S in your life, which should be removed so that the heart attack can be, prevented. And so you cannot prevent it and predict it 100%. Then identify, like in any case, identify the risk factor at a very earliest age. So that is why preschool or pre-university health checkups is important. And you pick up, so you need to be, from public healthcare perspective, you cannot, be doing CT angiography for every human being. You need to find out who are the people who are at a highest risk, and there you need to invest. And as all of us are saying, that pollution, either you create your own by smoking and drinking excessively, or you live in an environment which is polluted. Both the things would happen. Even if a lean Indian is getting more heart attack because he has got other risk factors, either he's stressed out, or he's taking a lot of sugar, or he's not working out, or has got a pollution. So these are the things which we need to be mindful of, and you can do your bit. And definitely those people who have got better lifestyle, they live longer and they would have less chance of heart attack. But you cannot predict, and the heart attack when it is coming.
So you've been practicing for so long, Dr. Viveka Kumar. Which is the biggest misconception about heart attacks or heart health that you have seen?
Yeah, so I think the misconception that I'm lean and thin, and I'm, so this is not going to happen in a person who is not obese. So they feel that it is being just a slim person would prevent you from heart attack.
It is not equal.
It is not equal.
What is the biggest misconception you have seen in your practice?
The worst part is that when people ignore their symptoms, the telltale signs which we discuss, they ignored, and people lackadaisical attitude towards their health, and then suddenly they are caught unawares. They suddenly end up. What we are seeing is just 70%, of which, if he's fortunate to have a primary angioplasty in time, we would be able to salvage almost 70-80% of that. 20% will still die there. Even if you reach hospital and you're treated, but if you came late and you missed the golden hour, the initial 90 minutes or 120 minutes at 2 hours, if you miss that part and doctor has fixed your artery by angioplasty, there's a high chance that your heart functioning will be dipped to half of it. So to stay away from that also, we have to report in time to the hospital.
Okay.
And on the prevention note, Dr. Viveka has already told you, one must submit to some kind of check at the age of 40 and beyond. If the check is found to be normal, it could be done every 2 to 3 years. But if it is abnormal, then every year you must check your blood parameters and other cardiac tests.
All right. So we're going to do some fact versus myth, and I would ask both of you these questions. The statement is that heart attacks only happen to older people. Dr. Viveka Kumar,
So
fact or myth?
So this is a big myth, because it can happen, as I said, that even in younger people. And in India, the paradox is that more than 50% of the heart attack is happening in age less than 50 years.
You think? Fact?
Exactly. Young heart attacks in particular are very common here, and we just missed out on the people who are going to the gymnasium. So in young people, we're very, very cautious to tell them that don't take any additional substances under the advice of your raw trainer. Okay. So stay away from taking artificial substances. If you are into gymming, take protein from the natural sources. Okay. Avoid those substances.
Okay. The next myth or fact versus myth, he told me, I know what he's going to say, but I'm going to ask you. If I'm thin, I cannot have heart attack. Thin means not equal to heart attack. Is that true? Is that a fact or a myth?
If you think that you can have a
thin, but thin ho to heart attack nahi ho sakta.
No, this is a big myth, especially for Indians. The lean-looking Indian could still be having visceral fat.
Really?
Fat around their organs, around heart, around intestine, liver, and all.
So what does that have to do with heart attack?
So that would mean that you are still depositing cholesterol in your coronary arteries, though your weight and your figure is lean. But still, if you are predisposed by virtue of having these risk factors, you could still suffer a heart attack. So being lean is no guarantee that you will not have a heart attack.
Okay.
So that's very important.
Okay. The next myth versus fact, Dr. Viveka Kumar. Chest pain is the only sign of a heart attack.
So that's a myth, because chest pain can happen only in 70% of the people. Rest of them would have atypical presentation. Okay. So that would be feeling of severe gaseous distension or acidity kind of symptoms. A lot of would have the jaw pain, A lot of would have a back pain. So these are, we call it the atypical presentation of heart attack. So chest pain alone, not. And then how do you know that these atypical presentations are heart in origin? You need to see that these are things which had never happened to the person before. So if the acidity problem is out of proportion and this kind of severe acidity problem had never happened to him or her, then it must be a cardiac cause, has to be ruled out. Similarly, the jaw pain which is radiating both the jaws or in one side of the jaw, and patient had never a similar kind of problem, then obviously, so his tooth pain, he would say that, this is not like I had a tooth pain before. So so atypical presentations have to be watched for, and then you need to rule out. So ruling out is something which is very, very important.
And what you're saying is there is no one sign which is chest pain that you're having a heart attack,
Yeah.
right? Next, fact versus myth. Stress can be the only cause of heart attack, or a heart attack can happen only because of stress. Is this true or is this a myth?
Stress alone could lead to heart attack, but one has to look for other conventional risk factors in these patients. They could be having high cholesterol, they could be having, which is not known to them, or they could be hypertensive, they never get their blood pressure checked. But yes, acute stress can lead to heart attack, although it's not very common, but and a chronic stress definitely leads to heart attacks in the long run.
All right.
So I should curb that.
Okay. So next, fact versus myth. I'm going to ask Dr. Viveka Kumar because I can guess what you're going to say. I'm going to ask him because you alluded to it. So Dr. Viveka Kumar, the next statement is, if I have a heart attack once, फिर तो नहीं होगा, मैं बच गई, बार-बार थोड़ा bad news आती है.
Yeah, so that
Is this
so that's a big myth.
the myth?
So it's again a big myth. So people used to say that, I have one heart attack, then it will not happen. So on the contrary, if somebody has got a cardiac event, heart attack or a small heart attack or big heart attack, they are almost at a 2 times higher risk of having it again. And that is the reason why we say that when you have a person has an heart attack, he has to be extra careful, and those cares are called secondary prevention.
We have in our follow-up patients who had a triple vessel disease. There are 3 arteries in the heart, so all had blocks. But those blocks were manageable on drugs. They were not causing any symptoms.
Drugs, but there were no.
We did not do any intervention to them. And we have people on record who, over the years, last 10 years, 15 years, have just won over those blocks by merely changing their lifestyle and regularly taking drugs. So it is possible to regress this process of hardening of arteries by your lifestyle change and drugs and needing no intervention.
But the
So
drugs
that's the contrary view.
But the drugs continued.
Drugs have to be doing drugs for cholesterol, drugs for blood thinner, drugs for blood pressure control, beta blockers. So there's a whole list of 4 or 5 drugs plus a regular lifestyle. And these people do well. They have never required a bypass surgery or an angioplasty.
So you're saying it is in your hands.
So lifestyle is very, very, it is in your hands.
That's great. Thank you so much, Dr. Viveka Kumar and Dr. Chandra, for joining us for this conversation and busting so many of these myths regarding heart health and heart attacks. And you cleared so many of those clouds on what really is a heart attack and the lifestyle choices that we can make to reduce our risk. You have helped us a lot and in creating this awareness for patients so that they can take their health in their hands. And perhaps it's also jolt people out of their complacency regarding their heart health. And we'd like to wrap it up here, but with a promise that we'll be back again and we'll continue this conversation so that you can have good heart health. Stay tuned.